Scott, see you soon. We hope to see you at the WWAY Health Fair. It's tomorrow, where we will have a lot of vendors out there. A lot of information available at Independence Mall in Wilmington from 10 a.m. to 3 p.m. And as part of our lead up to the event, we're introducing you to some of the doctors who will be on hand for the event. So today, to wrap it all up, Dr. Daniel Barzana tells us about the symptoms and risk factors of an abdominal aortic aneurysm, or AAA.
So AAA is a disease process that affects the aorta, which is the largest blood vessel in the body. And it's basically a weakening of that artery, and the artery balloons out. And over time, there is risk that the artery can become weak and eventually can rupture and lead to fatal complications.
What are signs or symptoms of this?
Most commonly, there are none, which is what makes it such a dangerous problem. But if you do start to develop symptoms of it, it's typically abdominal pain and back pain.
Is there anything that you can do to prevent this from happening?
So there's nothing you can do to prevent it, but early detection of these aneurysms can lead to early treatment and prevent complications secondary to it. We offer a screening program here, and screening should be offered to any male over the age of 65. We drop that down to age 55 if they've had a family history of aneurysm disease. You should also consider having screening done if you're a woman who is over the age of 65 and has a history of smoking. Risk factors tend to be smoking, males, patients with family histories, and genetic predispositions are the major risk factors. If you have a family member who's been affected by aneurysm disease, you need to be extra vigilant and definitely seek a screening test to be sure that you're not affected by this. Additionally, if you're over the age of 65, you need to consider having screening done for this. This is a problem that, undiagnosed and untreated, has fatal complications, and with early diagnosis can readily be treated. So generally, it's a very low-cost test. Most of the time, this is covered by your insurance companies. And even if you don't have insurance coverage, it's a relatively low-cost test out of pocket. And if you do not have the means to have this done, we have a foundation here that patients can reach out to obtain coverage.
Anybody that's home that wants to have this screening done, they think they might be at risk, how can they go about getting one of these screenings?
Probably the simplest technique is to contact their primary care physician, and they can go ahead and facilitate arranging a screening.
All right. We'll see you there, right?